So who here brushes their teeth? just a couple of people. Like, welcome iBrush to SF New Tech, and herein is Hee-chan Cha.
Thank you for coming and waiting. And I've been awaiting this moment for 1.5 years. So I'm going to talk about something visible and tangible that can change your health for life. Today, toothbrush is reinvented. Let me introduce iBrush. And this is the future of oral health care. Thank you. Oral health is not just about problem within your mouth. It's the gateway to your whole body health. So oral disease worsens cardiovascular and gastrointestinal health and worsens diabetes and affects bone disease like osteoporosis and arthritis. And especially for women, it can even result in preterm birth. And knowing that there hasn't been much technological improvement in toothbrush, we did something better. And second, over 70% of American adults have some kind of oral disease. And due to the high prevalence rate, and tons of billions of dollars are being spent on dealing with this disease, and now it is time to move on to the next generation of toothbrush. And lastly, nowadays people are looking at 100 years for their average life expectancy, and people are now paying more and more attention to keep their health, and the market is growing. So what makes iBrush unique? It's different. It uses light to kill germs and promote healing. And each wavelength has its own health benefits. For example, for blue, it kills germs and whitens teeth. For red, it's healing. It relieves inflammation and promotes healing by stimulating collagen secretion. And collagen is one of the main ingredients of gum tissue. So as you can see, these treatments have been practiced in the clinics. And iBrush will bring the same effect to your home without charging hundreds of dollars each visit. So iBrush looks like this. It's ergonomically designed. It's easy to grip for all age groups. So I'm looking at $650,000 for production, marketing, and clinical test. These three things are all scheduled and ready. So all it needs is a little push. And this is all about the team. So iBrush has built a great team of professionals in dentistry, oral surgery, and medical research. And we all share the strong enthusiasm for this project. By the way, prevention is the best medicine. And iBrush can do that better than any other toothbrush in the world. So for your better life, iBrush. Thank you. Any questions, please?
You have nice teeth. Let me start. So are you just applying light to your teeth versus brushing them, or is there a brush component as well?
So first thing that you need to know is that the conventional toothbrush was invented like 3,000 years ago. And there hasn't been much improvement. And all that feature that are available out there is like vibration. And knowing that the high prevalence rate, like 70% of American adults having gum disease, I think that's a problem, and we need to solve that. And applying light may sound simple, but it has been done for thousands of years and it's proven to be effective in the medical industry. So why not apply that to your daily oral hygiene process? Yes.
Okay, I got my teeth whitened a couple of months ago using light treatment,
Yes.
and it was agonizing. So your proposition here absolutely terrifies me. So my question to you is, what are the chances of getting this FDA approved? Are there any dangers with this? Because this looks like a very dangerous product.
So probably the treatment you had at the dental office was like 1 day visit, or how many days was it? So how many days of duration of treatment was that, the thing that you had at the 3 days? So for 3 day treatment, it's very intense. And they are actually using the higher concentration of hydrogen peroxide, which is actually not allowed to use by the FDA. So the thing about iBrush is that it's generating very subtle and small changes on everyday single basis. So the change may not be dramatic as much as what you did at the dental clinic, but when you think about the time period of time that you're using this product for years, 5 years, 10 years, then the gradual change will definitely come without causing any pain. Is that answering your question?
Just right there. What's the price, please?
So the highest end toothbrushes out there in the market is like $200. So I'm targeting this product at $100-ish.
What wavelengths of red light are you using? Are they the wavelengths prescribed by NASA?
I can definitely tell you. So there are medical research papers out there, and I'm from medical environment, and it is 635 nanometers.
So I wanted to go back to Miles' original question a little bit, and
Yes.
I have a segue to that. So this is in as a supplement to brushing, right?
Yes.
Okay. And so I see you're wanting to do clinical trials as part of this. What have been your clinical trials to date, or what have you done, prior to getting this actually in a prototype state?
Okay. So there are two ways that iBrush can go to the market, either as a electronic toothbrush or as a medical device. As for Korean market, I can release this product as an electric toothbrush. For US market, I have to be careful in terms of describing the benefits of this toothbrush. If I want to just publicly say, okay, this will be the ultimate answer and heal all the gum disease you have right away or in 2 months, that has to be definitely certified by or approved by FDA. But there are some ways that I can bypass without offending the regulations of FDA. So I have to be careful in terms of the expressions that I use. And as for the clinical trial, it is not really required to do that clinical trial, but the reason why I'm pursuing this is to have a stronger background evidence. And already there are experiments done in laboratory, and the experiments were done in the animals and then also for humans. So the purpose of doing clinical trial is strengthening my product compared to others. And it's already, the application was submitted, and it will be initiated very soon at a university hospital.
This is just a quick question.
Yes.
I am so impatient, I try to limit my brushing time to less than 30 seconds.
Mm-hmm.
So my question is, after my 30 seconds, how long do I have to apply this light to my mouth?
So you can choose what mode you will use when you're brushing. So as I showed, iBrush has 2 different wavelengths, which means 2 different modes. So let's say that you're suffering from lots of plaque forming in your oral cavity, and then definitely you'll choose the red light, the blue light for that purpose. And if you're having much bleeding in your mouth, then you can choose to use a red light. And the time, definitely it is longer the better. And I can tell you that I am preparing the next generations of iBrush after this, which can significantly reduce the amount of toothbrushing time with the combination of toothpaste with some chemicals called photosynthesizers. They are already approved to be used. So definitely, if you're going to reduce your time on toothbrushing, iBrush can help you with that.
So given for real efficient use, wouldn't it be more appropriate to have like a sustained, consistent light transmission to your teeth that would be like in a retainer type of format versus a thing that's just in your mouth?
Yeah, those kind of applications can be done too, but the reason for embedding that light technology to toothbrushes, I didn't want people to spend extra amount of time for their oral hygiene maintenance. So I wanted people to take care of good health of their mouth while they are just doing the daily routine. That was my goal.
So you envision people prior to your second release to have two units on their bathroom sink. One is a regular brush and the second is the iBrush. So it's a two-step process still.
Uh-huh. No, the iBrush itself has the bristles.
Oh, so you can brush with
yeah,
the
sure,
iBrush.
definitely, yeah.
Ah, I forgot. I didn't hear that part. So you can get it wet and get crest on it and all of that good stuff.
Okay.
Yeah. Okay. Any other questions? Who wants one?
Yes.
Everybody wants one.
Here. Yes.
Is that a question or you want one? She wants one.
Oh,
she
thank
wants
you.
one.
Please
$100.
go to. Yeah. It's not showing the.
Greg. Can you put his website on the... Greg is thinking about pearly whites right now.
Thank you for your patience. It's not, oh yeah. So please go to introducing iBrush.launchrock.com, and you will be enlisted to our mailing list, and I'll keep you posted. It's pretty much ready to go to mass production, and you'll see the product very soon. I'm trying to release it near the Christmas season this year.
Are you going to go direct to consumer or are you seeking retail distribution?
Both ways. It's my first business. I'm very thrilled, and I've been working very hard for the past, 1.5 years. And I'll be glad to bring a better product to you that I would use myself.
I hope
Thank
so.
you.
Very nice. Congratulations.